channel DZRJ 810 AM, Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗵𝗶 as we discuss the latest health and medical topics with doctors from 𝗵𝗶. For a healthier and uplifting lifestyle, tune into Healthline with 𝗵𝗶 on DZRJ 810 AM, Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗵𝗶, Mondays 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗵𝗶 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗵𝗶. I'm your host, Nicole Jacinto, and today we're going to talk about rabies with Dr. 𝗂𝗏𝗏. Okay, Dr. 𝗂𝗏𝗏 is an emergency medicine specialist, and he works in 𝗵𝗶, of course. And guess what, doctor? We're in the same building. I mean, if you're in the emergency room, like Tower 1, I am with a patient. I'm a bantay.
Okay.
So
I hope everything's okay though.
yes, thank you, doctor.
Yeah.
Patient is better now, so I'm here in the room, and isn't that cool? We're broadcasting from the same area, and I'd like to, good for technology that we can do this and everything. So excuse me, folks, if I'm a bit tired and I'm not tired enough to do the show and topic, which is interesting to me. I was gonna have little guests on the show. Excuse me, Tata. I'm doing the show. This is the kind of thing that happens when we're live. Tata, estoy haciendo el show. Okay. Anyway, patient is a little bit. All right. So anyway, there. Doctor, okay, let's talk about rabies, no? I was gonna have a little guest on the show for my little children. They were gonna watch, but they're not here, of course, in the hospital. My little doggies, because they were really interested in the topic when I told them about it. So okay, so they're just gonna be watching from home now and not present on the show. So right. Doctor, let's talk about What can you tell us what exactly is rabies? If you can give us an overview, the virus, blah blah blah, that kind of thing.
Right. Yeah. Good afternoon again, Nicole, and good afternoon to everyone. Again, thank you for inviting me over to this show. Yeah. So let's start it from the very basic. What is rabies? So rabies is a viral infection, usually infecting is what we call zoonotic infection, and they only infect animals. They're very particular, usually with warm-blooded animals like mammals. And this can cause a disease that affects the nervous system, the brain and the nerves of an infected animal. It is transmitted in many ways, from usually from saliva or from blood to blood, or even like inflicting wound, and then spend the virus coming from an infected animal contaminates infect the other animal.
Okay, so that's great. Rabies is a viral infection. It's a viral infection, and then so it's not just any animal. You said it's particular to mammals. So warm-blooded animals. So like if we think about reptiles and like snakes and all of that, well, you have a bigger problem with snake bites usually.
Yeah, I know.
First. It's not it's not really present there because of course a lot of people would say, what kind of animal? Just any animal, right? Okay. And okay, so usually it's transmitted through the saliva.
Through bites, yeah.
Right, okay. But even as you said, blood to blood.
Yes, blood to blood yeah, contact, and even like saliva to mucosa, meaning in
Yes.
there's no direct bite, but the
Yeah.
saliva of the animal, like the eye or the oral mucosa with some open wounds, then
Mhm.
the virus can be transmitted in those areas. And I agree with
Okay.
you, Nicole. Yes, these are the few questions that people would always ask: who are the animals that can
Yeah.
transmit rabies? So in general, as you know, many of our for sure listeners and viewers are for parents already now. So you know, dogs and cats can
Yes.
transmit the rabies virus, and that's why there's a big support on vaccination for these animals, no, domesticated animals. But
Mhm.
many of our patients tend to forget that even bats, squirrels, raccoons,
Rats.
horses,
Yeah.
yes,
Or
and
also,
monkeys.
yeah. And monkeys, yes.
Sorry, no, not rats, bats.
Bat. Okay.
Bats,
Okay.
raccoons, horses, and monkeys can transmit the virus. Rats, on the other
Mhm.
hand, they do not have
Ah, they
the
don't.
rabies.
Okay. All right.
Yes.
So thank you for
And
clearing up that
yes,
misconception. Perhaps
yeah.
later we'll have more time to clear up
Mm,
misconceptions.
right, right,
Okay.
right.
All right.
So
Sorry, go ahead, doctor.
So any exposure from these animals, no, either when you're handling them or while you're traveling, you get to meet these animals. Some of the playful monkeys, you go to some temples, some areas, would have some bite or scratch you. This means that you guys need to have, vaccination. It has to be seen by a
Yes.
doctor and have a vaccination later on.
Okay. Right. Okay, so doctor, let me ask you like a few like very there these questions are basic for you, but just I guess some examples. So the sources of animal bites, I mean
Hmm.
it's transmitted to humans through bites or even scratches.
Yeah.
So
Yes.
like as you said, through open, not even wounds or mucosa. So mucosa like the eyes or the
Yeah.
nose, the mouth, no?
Yes. Yeah.
Can I ask you, okay, so you already, I was gonna ask you to name some animals and you did those animals. We love them. Okay, now, is it possible, okay, you did mention scratches and all that.
Mhm.
Now, since, so rabies is not, because okay, rabies is not just transmitted through saliva. It can
Mhm.
also be through
Mhm.
wounds from scratches if an animal is infected.
Yes.
Like let's say
Mhm.
your cat, you didn't know
Mhm.
had rabies, or you're trying to help
Mhm.
a stray cat and it scratched you. It can also be
Mhm.
transmitted through the scratch itself.
Yes,
Okay.
because some of the viral particles of the virus can harbor in the under clippings of the nails, and then can be transmitted. Although, as we get to discuss it later on, all of these exposure are categorized from high risk to low risk. So we have level one or category one, category two, and category three,
Mhm.
and exposures to such. Depend That is when we depend on our vaccination
Yes.
schedules,
Okay.
what
So
kind of vaccines we're going
I'll
to give,
ask that.
etc.
Yeah. Okay.
So even if there is theoretical exposure, the some of them, like petting
Yeah.
animals, are very minimal to no risk at all, no?
Yeah.
So maybe some of our viewers might be getting confused. They felt like they're exposed, but the doctors didn't give them. Probably it's because the category is too low to give them the vaccination. So
Yes, yes. And like it's so like some might be like, oh, if I pet horses, will I get it? No, you won't. I mean,
yeah.
the most actually is, well, unless the horse perhaps bites you, but they'll just kick you.
Mm,
In my
yes.
experience, I
And
kicked by a bunch of
the
horses.
same as exposure. Yeah, that's true. And that's also trauma cases for us when when the horses would kick patients. But yeah, also exposure to not to saliva, exposures to urine and
Mm.
feces. So some of our viewers might think handling feces or urine, they can be contaminated with the virus. These are very low risks areas for contamination.
Okay, so let me give thank you for giving actually those scenarios, because I wanted to give you a couple of scenarios, no. Okay, you tell me if it's low risk or not, or this might
All
be
right.
interesting to some viewers because they will
Mm-hmm.
ask a lot of questions. And I
Correct.
mean, we'll ask each other a lot of questions. So let's
Mm-hmm.
say you're sure, let's say a dog will come up to you and
Mm-hmm.
dog will lick you, and
Mm-hmm.
you're you. they would say don't let a dog lick an open wound.
Mm-hmm.
For a cat,
Yes.
well, the
Mm-hmm.
cat has the rough tongue also for their, but because that you might get rabies that way. Is that
Mm-hmm.
true or false?
With open wound, yes. With no open wound, very minimal to low risk.
Okay, so what if like how about if let's say you pet a dog, or even if it's just your own dog, and
Yeah.
you had a shot of rabies, and we'll talk about effectivity of vaccines later.
Briefly. Yeah.
And then you forgot, or you didn't get to wash your hands. Let's say I pet the dog, and then dog licked the hand, then scratched here, and there was an open wound pala, or caused a wound. Can you get rabies that way?
Because rabies once exposed to sun, are they easily um, destroyed to direct sunlight. Not very low risk. Like
Okay, very low.
That's very indirect way of getting it. So usually rabies is very direct contamination. So
It's like because
from
yeah.
yeah, it has to go from the mucosa or the saliva where the rabies virus is, and then transmitted straight to the open mucosa to the open wound, and uh, become infecting the other individual. But like if it's like indirect, like you forgot to wash your hands and it stays for a bit now, a couple of minutes,
Mm,
the rabies easily it dies down right away from the drying of the saliva and exposure to the sun.
okay.
So yeah, but with that, of course, we want to also emphasize hand washing. No, regardless if it's low risk or high risk, no, people should always wash their hands
Yeah.
for because it might not be rabies, maybe something else.
Yeah, it could be something else. Frequent hand washing. That is always a good thing. And just put lotion if you feel like your skin is dry or
Right,
something. And then,
right.
doctor, okay, so just indulge me in another scenario. So, sometimes we kiss our dogs, or sometimes our dogs
Mm-hmm.
like kiss us. And then actually,
Yes.
one who gives me a facial, she's like,
Mm-hmm.
to kiss me, and I
Right,
just
right.
can't help it. I let her.
Mm-hmm.
Um,
Mm-hmm.
and I'm sure she's vaccinated for rabies, but how's
Mm-hmm.
that like? Or what if sometimes it's not intentional, like even some pet owners, or you're visiting someone and the pet likes you, and you go hello, and then they just like they sneak in a kiss, and then
Yeah, yeah,
they get to lick your lip, or sometimes they
yeah.
even get to touch your tongue, then you're like
Right.
okay, but
Yeah.
so how about that? Is there
That's
any risk?
also very minimal as long as there are no open wounds on the lips, no abrasions, or any areas or any form of like dental infection or tongue infection, like if any gingivitis that can be an open wound, or an area for the rabies virus to go inside.
Okay.
So if that's the case, then that's very high risk already. Yeah, but if just
Yes.
licking and everything is very low risk.
Okay. Yes. I mean, people, because they might get there, oh my God, don't kiss
Mm-hmm.
your dog. Okay, first of all, for whatever reason. But then, sometimes they will get like, I've
Mm-hmm.
seen it happen to a friendly person and a friendly dog.
Yeah.
And then,
Yeah.
also my dog who does my facials. I'm,
Yeah,
I
yeah, for sure.
wake up and
Many many of our
she's
many
kissing
many many of your viewers for sure like you would be,
me.
yeah, again waking up, or once they get home they start licking you all over,
Yeah.
so yeah,
So,
basically
as long
that's low risk as long as there are no wounds.
yes, thank you, doctor. Because thank you, doctor, for being so very open about it and for sharing information. Because it's really important for people to know that not only the
Hmm.
dangerous part, the part where we shouldn't freak out so much.
Correct.
Um, and because we do live with a lot of, well, we've always lived with animals.
Yeah.
But okay, so let's say okay. And the thing about the bites is that it's because it creates a wound already, and that's
Correct.
when they go in. And
Yes.
you mentioned like, let's say a monkey scratches you, you should have
Right.
that, no, if like
Yeah.
I actually got scratched by a monkey once who was in a cage,
Hmm.
but of course I'm still here. But so if
Yeah.
it's true, like you okay, even scratches and all that, it could be under
Hmm.
their nails, or maybe they were
Yeah.
like like
Yeah, yeah, licking their, yeah, and then transmit,
they're
yeah.
giving themselves like a manicure, then they're like,
Uh,
then, you know.
yeah.
Okay. All right. So, okay, doctor. So just those things, especially if the animals that we come in contact with, there's a lot of like ecotourism today or anything. Like we don't know
Correct.
anything about them, or they're a bit more wild, they're not exactly
Mhm,
domesticated. Then for that we
mhm.
should be careful. Okay. So doctor, in human beings, what are the early signs and symptoms that somebody has rabies? And
Okay.
that
So before we go that, I think Nicole, one of the also few questions that people might
yes.
ask is once you're contaminated or you're exposed to, you think someone or an animal has rabies,
Yeah.
when do you start getting the symptoms, right? So
Yes. Yeah.
usually, to be honest, this particular infection, so rabies in general, has what we call incubation period. No, so unlike other infection, when you start, when you when you sneeze and you caught the virus already, you get the symptoms right away. But for rabies in general, it takes T7.
Mhm.
A few days to even there's like a historical documentation that
Yes.
after 7 years from the exposure, they get the rabies. So like a bite or a scratch 7 years ago, yeah, they get infected after 7 years. They get the symptoms after 7 years. No,
So you
and
could
also,
actually ah
yeah. So
7 years.
basically, yeah, basically, a few days to years, you can still have you know presentation of the infection. No, so you get contaminated. The virus was transmitted to you 7 years or 6 years back, and then you start getting the symptoms after 6 years or so. That can happen for rabies. That's very particular for this virus.
Okay.
And with that being said, your question is what kind of symptoms? So initially, the symptoms, as with any viral infection, are flu-like. No, so malaise, a bit of low-grade fever, muscle ache,
Mhm.
joint pains, headache. Very, very constitutional, very non-specific. Right? It can be any other disease entity. But then it gets to two forms. No, so from a first or what we call acute phase, the first symptoms, no, symptomatology
Mhm.
presentation, no, it can also have some tingling sensation, burning sensation on the bite or
Mhm.
the bite area or the scratch area where the wound is. Then it will transform into two forms. No, one is the what we call so there's paralytic, no, form, no, when patients would go to like semi-paralyzed state, no, and there's one is like a very high, we call it like anxious or very high energy symptoms. No, like they start
Yeah.
when they're starting having tremors, chills, and
Mhm.
they get to have like water phobia. No, because of the pain that they experience from the cramps on the muscles and the uh,
Okay.
throat. No,
So that's
so
where that comes from.
yeah,
The thing we hear when we're younger about no, they won't drink water, they don't want water.
right.
Yeah,
Yeah.
okay.
That's the manic. I forgot that. That's a manic. I tend to forget it a while ago, but it's a manic phase. No, so it seems like they're in mania because of involuntary muscle spasms, agitations, and then yeah, hydrophobia is also part of the presentation. But
Yeah.
then again, initially it starts with flu-like symptoms. It can become like very aggressive, very manic, and then they can become paralyzed. In that state, lethargic and almost comatose. The thing with rabies vaccine, and this I really would want to emphasize to any of the viewers and all of my patients I get to see in the ED, I really would want to emphasize the mere fact that you get the symptoms already for rabies, that is too late because once you get infected, meaning you start having these presentations, you have started having these symptoms, there's virtually 100% mortality rate. Everybody dies once they get
Yes.
infected. So I
Is there
really
any
would want to emphasize that.
is there any best case scenario if you get I mean, I'm asking this because you said it could take up to 7 years for it to manifest,
Right,
no?
right,
Is there
right.
any best case scenario that that could happen? Like, okay, I got scratched by that monkey. That was more than
Right,
7 years ago. I was 12
right.
years. Okay,
Yeah.
so now I'm thinking, okay, is there any best case scenario that it's possible I contracted rabies, but it doesn't show up at all because my body, like it doesn't, or does it all eventually manifest, or does it always manifest? Like you've had documented cases where 7 years later it was traced
Mm-hmm.
back to a site that
Mm-hmm.
wasn't maybe treated properly, or
Mm-hmm.
the
Mm-hmm.
infection didn't, like, how do you say, flourish then in
Yeah.
the
Mm-hmm.
body. But is there a best case scenario with that? And we know the worst case scenario is death, and in
Yes.
between those-
Best case scenario, you survive. The best case scenario, you survive because you get vaccinated.
okay.
So get the vaccine, the post exposure vaccine. There are some also. I mean, to be fair, there are also some
Mhm.
documentation on survival of very rare people who would survive rabies.
Mhm.
Rabies in general. But what we want to emphasize is we don't want to take that risk.
Yes.
So I mean, if virtually almost all would die once they get the symptoms, then you just don't want to take the risk, and like maybe it's me
Yes.
who would survive, no? But
Mhm.
then again, if you don't have the symptoms yet, then that means in general you don't have the infection yet. You might be harboring the virus, but it's not enough to give you the clinical presentations. Then that means there's still time for you to get the vaccine.
Okay. So it could
Yeah.
be like, when you said you're harboring the virus, but it's not enough. It's like there's a certain load. Like, could I compare it to
Correct.
that?
Correct.
So let's
Yeah.
say, okay, you got part of the virus, but it's only like 20 to 50% of what
Mhm.
can really start ticking and making you
Yes.
sick. Okay,
Right.
all
So
right.
like viral load, and of course it also depends on the immune system, how the location where the bite is or the scratches, how much is the viral load. These are the things that might be considered. But of course, for practical purposes, again, we virtually just would let them
Mm.
get the vaccine when it is 100% vaccine preventable.
Mm-hmm. Yes, of course, doctor. And also, like, I was going to ask you, I asked you the best and worst case scenario, and you mentioned some of the presentations. Are those a progression earlier? Like, at first, it's just is that a progression? Like, it can start with just the lethargy, the malaise, the feeling, the non-specific, like flu-like symptoms and feeling weak,
Yeah.
and then does it usually, can it stay like that, and then suddenly, it's already at a later sort of stage? Or does it really progress to being manic and then having
Correct.
hydrophobia? Is that a progression, or it can is that a progression from one step? The first step is this, and then the second step is, it gets worse and worse, the way it
Yes.
presents, or okay, so that's the
Yes.
progression. Okay.
So the progression is the first phase is the flu-like symptoms, a very non-specific symptoms, and then it progresses to a very specific, because as rabies is a virus, no? So they would tend the body would tend to react as if it's a viral infection initially, but it's a very specific virus, as I said earlier, that really directs its menace in the nervous system. So
Yeah.
from an initial
I don't
reaction of the body
Yeah,
to the
let's
viral,
not just yeah,
and then it goes
to
straight to the nerves and to the brain. And then the presentation, the one I'm mentioning, the furious, the manic, and the paralytic phases of rabies infection is because the rabies is already affecting the nerves, the nervous system. So the brain,
yeah.
it affects the and how the nerves also uh, coordinates with the rest of the body.
Yeah, the
So
synapse start not communicating, and that's maybe that's why they also, like, that's a term to describe someone who's rabid, like
yeah,
okay.
yeah, pretty
Uh,
much.
yeah.
As you get to see in the movies, they try
Yes.
to like they're out of their minds basically. Imagine
Yes.
like your brain being hijacked by a virus, and then
Yeah.
that virus is doing all this wreck inside your brain, so
Mhm.
you can't even think properly, you can even have any ways. So patients can also cause psychosis and delirium.
Mhm.
They can have excessive salivation, difficulty
Yes.
swallowing.
Yeah.
agitation, anxiety, confusion, hallucinations even, or
Mm.
abnormal or aggressive behavior, aside from the hydrophobia. And even in some cases, very severe ones, they also have aerophobia, no? So if there's like a wind coming in
Yeah.
and because usually when there's like strong wind, you feel like, y- I don't know, it's kind of like in Tagalog, it's halaki, but you feel like, no, it's overwhelming you. And because
Yes.
in rabies infection, rabies patients, so patients with rabies, they can't have that kind of reaction, and then they cannot coordinate reaction because their nervous system is not properly uh,
It feels so strong to them. It
correct.
overwhelms
So
them. And
yes,
then,
exactly.
yeah.
And
Like,
then plus,
you're such a dynamic speaker, and your explanations, like, I had these questions prepared, but I feel like just going with the flow. You know, you were talking about, of course, we have to answer some questions, and you've already
yeah,
answered them. When it comes to, okay, so that's, their senses are heightened, and that's
right.
why. But I think okay, so what's important here is that you also kind of remember your history of getting an animal bite or something, no?
Correct.
Because if if it's 7 years, most of us won't remember. I
Yeah,
do. It's
yeah.
still, it could be, could not be. So the thing is, um, what like if someone gets bitten by an animal or scratched, that
Mm-hmm.
could possibly be a carrier of rabies.
Mm-hmm.
Um, what should someone do
Okay, so let's start with what to do initially at the site when
initially?
it
Yes.
happened, right? So as I
Mhm.
said, these are very these virus are easily you want to remove many of the viral load, no? So at the very beginning, you
Maybe like
have
first
to
aid and then going to a
yeah,
doctor
right.
that
Once
you
a
maybe can
yeah,
take us
so
through that.
soap and water. Yeah, soap and water at the very beginning. No, wash the wound and irrigate it very thoroughly. No, very clean water and soap. No, that will start. Don't put anything else. So soap
Mhm.
and water. And if there's any kind of bleeding, just use a
Mhm.
gauze. If you don't have gauze, at least a very clean cloth to uh, put pressure on the wound to stop the bleeding. Now, again, as much as possible, one because there's like bleeding already. No, you don't want the virus to go inside and go to the bloodstream right away. So stopping
Yeah.
it is actually trying to minimize the damage. No, uh,
Actually, doctor, I wanted to ask you, when you put pressure to stop bleeding, so usually we just, if it's, we're not thinking about rabies or any other kind of like venom,
mhm.
that's, I'm thinking of the snake venom bites, but
Snakes. Yeah,
if
yeah, yeah.
let's say it's a puncture wound, or there's like, oh, okay, a
Right.
few
Yeah.
tooth mark here, whatever, and they're bleeding, so it's a deep puncture wound. When you say
Mhm.
stop the bleeding, do you put pressure on the wound itself, or is there another way to kind of stop it? Like,
No,
because,
directly to the wound. It
Mhm.
is not recommended to put tourniquet, especially if you're not a healthcare provider, no? Because unfortunately, when you put a tourniquet, and some patients would tend to put it very, very tightly, it also reduces the blood flow to the area and actually kills and some form of bigger damage to the other tissues that are not even affected by the wound itself, no? So again, clean with water and soap, and then put direct pressure on the wound itself when it's bleeding and go
Mhm.
straight to the hospital to get it checked. Um, it is recommended, no? There is no hard and fast rule, but I think the American College of Emergency Physicians recommends that the vaccine be given within 72 hours. No, that's
Okay,
3 days
reading.
from the, yeah, within 3 days. But again, the general rule is the sooner the better, right? If
Okay.
you have, wants to get it, then go straight to the hospital. And many of the
Mhm.
animal bite centers in the country are open 24/7 anyway, so you get the
Yes.
vaccine.
Mhm.
And then again, you might be given some, a thorough cleaning in the ER or in any animal bite center, and be given the vaccinations.
Mhm. Thank you, doctor, for explaining that and saying like, okay, these are this is how you should deal with it, because many people put all sorts of stuff, or like,
Yeah,
when we were younger, we were told like, the survival in the ganyan, and you sip out the
right.
venom, spit it out,
Yeah,
and
yeah,
also during the case, if you live in the city and you're not gonna really lose that much blood, don't do it to yourself. You may not be familiar if you're not a
right,
a healthcare professional, or if you're not
right,
someone who's very good and adept at first aid, then don't tie a
right.
tourniquet, and
Hmm.
just put just put pressure on the wound directly because
Yeah.
you just want to stop the bleeding in that sense.
Hmm.
Because I think some people have this fear. I know a lot of people have this misconception that the rabies will go in more if
Correct.
you pressure on the wound
Put the
directly.
pressure. Yeah. Mm.
Okay, so that's not
So
true. We,
that's not true in general because if the virus is there, the virus is there. Now, what you want to make sure of is that it's not, you get to control the bleeding and then you don't contaminate more than what it is. But then again, it's a case-to-case basis. Most of the, maybe like 90-95% of patients we get to see are really minor cuts and lacerations or cuts or
yeah,
wounds or bites. No, but there are also some rare cases and they're being mangled. Like, imagine like you're a stray
yeah.
dog mangling the leg. Of course, that means, there's excessive bleeding, a lot of tissue damage. Then
In
maybe a
different parts of the
tourniquet would
body,
different
or
parts are
yeah,
in the leg, like one leg is being mangled until the thigh. Now, that means there might be a need for a tourniquet. But in general, like for the most people that gets animal bites or scratches, a tourniquet is not recommended.
recommended. Okay, doctor. Once somebody gets rabies, I mean, first of all, is there a cure for rabies? And once somebody gets it, can they be cured?
Yeah. So, yeah, as I mentioned earlier, unfortunately, there is no cure for rabies. So again, virtually 100% of people who would have the rabies already, so meaning they've started presenting the symptoms, it's too late already. And we don't know, to be honest, and as I also tell to my patients, no, I'm always being honest. No, to be honest, I don't know if you're gonna get the rabies or if your animal or your pet has rabies. I
Mhm.
do not know, even if they're vaccinated, although the vaccine for animals gives them a high chances of not getting the rabies virus, but there's still a small chance that they might harbor the virus. So meaning I don't have, or any doctor would have no
100% sure.
knowledge on who we're gonna get the virus in that. But what we know of, and we're 100% of, is that once you have the symptoms, you'll eventually die.
Yes. If you don't
Uh,
get the
yes,
vaccination.
yes.
So,
So because the reason why the vaccinations just stops the virus to replicate inside the body and start having the symptoms. No, so even before the symptoms happen, so meaning the
Mhm.
virus is not enough to cause the infection, we stop it there. But like in once you have the infection, so meaning it already affected the brain and the nervous system, whatever
Yeah.
vaccine we give, there's no way, it's already there.
Yeah.
So that's the reason why we'd want to emphasize that even before you have the symptoms, just the exposure
Yeah.
or the chances of you getting the virus, we give the vaccine already.
That's a great way of explaining it, doctor. I mean, if it's there, it's not yet acting up as much,
Mm-hmm,
and you got bitten, and that's
mm-hmm,
probably it. Then get the vaccine. Um, because once it's already manifesting, okay, when it's at the point that it's manifesting when somebody is already hydrophobic and they're manic, can they still be saved with the injections? With
no,
a no. Okay.
no.
No.
So no, the only way is even before the symptoms to happen. No, so we
Okay.
give the vaccine.
Okay. Yeah. That's the most serious question I had to ask
Right.
because I
Yeah.
remember like learning that, and once a human being gets it. And also,
Mhm.
okay, um how effective, so when we're talking about the effectivity of a vaccine, it's really more effective. It's effective when the stage is still early, but it's not effective anymore once somebody is
Mhm.
already in
Mhm.
the latter stages. The
Let,
latter
let, at the stages of the
yeah.
infection. Yes. This is what we call pre-exposure prophylaxis. Sorry, it's not post-exposure prophylaxis, meaning you have an exposure to a possible rabies contamination, but
Mhm.
you don't have the symptoms yet. Now, again, rabies has incubation period, as I was mentioning. There's it's a time when the virus gets into you, but not enough to present the symptoms. So it doesn't start going to the nerves or to the brain, no, not yet. So at that time period, that's when we can intervene, no, and almost 100% effectivity. It shows that, in fact, the WHO declares that rabies is 100% vaccine preventable death. So
Okay.
meaning dying from the rabies is 100% preventable by giving the proper rabies vaccine. So yeah, I'm trying to emphasize is that unfortunately, because you have the symptoms already, and these are, the vaccines are antibodies, right? But the virus is already there in the brain and nerve
Yes.
system. There's no way they can neutralize the virus anymore because it's already there, no?
One.
So even before you have the symptoms, you'd want to neutralize it from the get-go,
Mhm.
from the very beginning.
Doctor, okay, so in terms of the human beings, is there
Mm-hmm.
such a thing as, because of course most of the vaccination that we know about are getting injections for to prevent rabies are the
Right?
ones that happen, after the bites or after the
Correct.
exposure, or
Correct.
possible exposure, because we're also not
Right.
sure if they,
Mm-hmm.
if
Correct.
the animals really had rabies and all that.
Yeah.
Are there any such programs, or do people get vaccinated like for rabies, like even for no reason? I mean, like not no reason, but because is it something that you do to prevent?
Ah,
I mean, have you
correct.
gotten rabies vaccines? Like, I just want to get a rabies vaccine just in
Yeah,
case
yeah.
I get bitten one
I
day.
mean, I see it. Actually, if you're gonna look at world records, one of the few things about rabies is that most of the cases of rabies are actually in Africa and Asia, no, 95%. And sometimes when you travel around, well, we're in Asia, so we're pretty kind of
Yeah.
exposed to rabies. But like those who are, maybe some listeners from the US or Europe, if they travel to Asia and to Africa, one of the things that they have to get is a rabies shot, a rabies vaccine before going. It's part of their, traveler vaccine program. But in general, like, no, these are, can be cases of giving pre-exposure. We call it pre-exposure prophylaxis, meaning the vaccine will be given even before there's a possible exposure to the virus. No, so these kind of people. No, so for us, technically, we don't we're already in Asia, so we don't have that pre-exposure
Yeah.
prophylaxis. But also there are categories of certain individuals who are at high risk of getting the virus
Work with animals.
because of the nature of their work. No, number one, those are working in the rabies laboratories. Those are doing the vaccines, etc., etc. So they have to have some of periodic
Mm-hmm.
vaccination for rabies. Second
Mm-hmm.
are those who are handling directly animals, like for example, veterinarians, no,
Yes.
who are even pet groomers for sure.
Yeah.
Yeah, I mean, we've seen a lot of them. Pet hotels, pet groomers who will be handling many of our patients, no, in the urban setting. They might need to get a vaccine, and they have to talk to their doctor about
Yes.
the the schedule for their vaccination. And these are individuals, no? So there's a category already of certain individuals that can be at high risk, no? But usually those are direct contact with animals.
Okay. Thank you, doctor. And okay, I know you're not a vet, but I'm sure you've spoken to a lot of vets and stuff.
Uh,
How effective is okay, let's say it's your own dog or your
mm-hmm,
friend's dog, and you know
mm-hmm,
that the dog has been vaccinated and has
mm-hmm,
all the records, but still
mm-hmm.
somehow the dog bites you or scratches you.
Yes.
How I mean, how effective is, I'm sure it's related. You can give us some kind of answer na how effective is the vaccine for the dogs, the
Hmm.
anti-rabies
It's
vaccine for dogs?
it's the vaccines for our animals and the rabies vaccine for our pets, no, are very very effective, no, almost 100%. But as with any vaccine, it's not
Mhm.
100%, no,
Okay.
almost, but not 100%. So meaning, um, as mentioned earlier, no, they might be
Yes.
interacting with any other animals that has some of the virus. They can get the viral. They might be harboring the virus even if they don't have the symptoms yet, and then transmit the virus because they're vaccinated, right? But they can still transmit the virus, technically to you or to any of to humans, no, and they can get. The humans can get infected later on, and usually the what as far as I know with that, I mean, I'm not a vet, but as far as I know, the only way to know if the animal is infected is also they're presenting outrageous behavior, like just what with people, no, the rabid animal would have some form of this kind of bizarre behavior,
Yeah.
and
Or the
yes,
anger, agitated. Yeah.
and
Sounds.
the only test for animals is to get the brain in check for the rabies virus. There's no way
Mhm.
you have to kill and to check
Yeah.
the animal. So meaning to answer you, yes, it can protect in high levels,
Mhm.
but it's not 100% sure. So meaning even if you're sure your pet is vaccinated with rabies and you get bitten by the pet, or by your dog, or by your cat, we still would want you to see a doctor, check on the wound, and categorize it. And depending on the category, give you the proper vaccination.
Does it?
Another thing for the rabies, sorry, for the vaccine with the animals is also it has time period. I think animals needs to be given booster. So really also depends on when
Yes.
you get the vaccine. So because
When, okay, let's say,
oh
oh, the booster, pala, they didn't get it, all of these
yeah
other factors. So you would be asking, like, I don't know, your friend, like, when was the last time your animal got boosted?
yeah
Like,
right
when it this happened. Okay.
yeah
And then doctor, okay, so thank you. So so there are a lot of factors. So you would recommend, of course, going to see a healthcare professional. And does
yes
it also matter where the bite is? I mean, what are higher risk areas for bites, like around the face or
yeah around the face. Yeah, so we again, as I mentioned, there is a category, so like the face, eyes, nose, like here near the head until the neck. These are high risk areas. So really would want you to see the doctor right away. I mean,
yes.
the main reason why it's so near to the brain, as I mentioned, rabies primarily targets the brain, the nervous system, and the brain. So the nearer
The
the
nearer it is.
the wound is, the nearer the virus can get inside the brain, the faster it can progress, and the more severe the symptoms can be. So meaning, if we're running against time because we want to prevent the virus to go inside the brain, we
Mhm.
want it to do as fast as we can if it's near around the area and near around the brain, so head in general. Of course,
Yeah.
the limbs are
Yeah.
less, but it really depends on how bad the wound is. So if there's any spontaneous bleeding, if it bled, no, yung hindi po yung some of our patients pinadugo, di ba? No, so 'cause sometimes they
Oo.
want paduguin, no. In
Kaya
fact,
natutuwa ng lollipop,
it is
patayin mo.
maybe we can talk about it later, but it's one of the things that we
Yeah.
do not recommend to do anymore, no. But yeah, so bleeding wounds, no, open wounds, macerated wounds, yung malalaking wounds, you have to go see the doctor, no. Again, we're not just talking about the rabies. We want to give the rabies as soon as we can, but also there are other factors, no. Other
Yes.
infection can be a good area for the virus to replicate also. So
That
you want to
mangled,
see a
you're
doctor.
resting around in the
Yeah,
mud, and then it's not rabies, but
yeah.
it's tetanus pala, that kind of thing.
Tetanus, yeah. So, and many of our patients in animal, when we're dealing with animal bites, they're not only given rabies, but also be given tetanus vaccines. No? So,
Okay.
as we're talking about it, please go see your physicians in Makati Medical Center any time of the day, and see have your animal
Yes.
bites checked, so we can give proper treatment for you.
Okay. All right, doctor. So actually, you have answered the question of the difference between what is, like, getting a post-bite vaccination as opposed to
Yes,
a pre-bite or exposure
for sure. Yeah.
vaccination. And then you started talking about the padugo and all of that. I mean, why don't we talk about all the stuff that you want to talk about, whether it's misconceptions that people have, or
hmm
how,
hmm
like, everything that you want to say, like, let's do it.
Yeah. So number
Yeah.
one, again, most common, many patients would ask us, rats, they don't have rabies virus.
Yeah.
So they
How come
don't,
that
yeah.
went
So
around? That,
Yeah, rat
that,
bite. You might talk about leptospirosis. You can talk about other infection, but not rabies. So usually we don't give vaccine, a rabies vaccine for rat bites. Second, human bites. Human bites, we don't give rabies vaccine
uh-huh.
also.
So
The only
even
way
if
you get
person has rabies and they bite someone else, you don't.
unless you're bitten by a rabid
Person.
humans,
Yeah.
but in general we don't, right? So
Yeah.
usual and
Mm.
human bites we don't give rabies vaccine. And please
Okay.
see your doctors. No, there's any other things that you get. It's not just about the rabies. It's 100% preventable. So please get
Okay.
the vaccine. Don't hesitate. It might be, and then there's other reasons
Yung
for
padugo,
not for
doctor, yung
delaying
padugo, di ba
vaccinations.
you were talking about the padugo? Let's get into that. Kasi I
Yes, the
know,
padugo. Wag niyo pong papaduguin. Wag niyo pong papaduguin. So sometimes like there's like a small wound lang, no? And usually the small wounds without spontaneous bleeding is like a category 2. It's a medium risk. No, it's not high risk. But once it bled, it becomes high risk already because the protective barrier of the skin is broken. It goes straight
yeah.
to the virus can go straight to the bloodstream, to the blood, and go straight to the nervous system. So it's
So in
much
fact,
easier.
you're
Actually,
making it worse.
making
In
it
fact, you're
easier for the
making
virus, making it
yeah.
worse. So we don't want that to happen. Wag niyo na pong paduguin. Wag niyo pong lalagyan ng any kind of herbal or whatever, mga herbal leaves, no, yung mga pinakuluan na to sterilize the area, no, kasi it gets
Yes.
more infected. It can actually have burns. Also, one of the few things, once you get the rabies vaccine, kung hindi po available yung vaccine, the DOH and even WHO recommend to give so that we can give the vaccines in proper scheduling.
Yes.
You can shift to a different vaccine if really not available the first vaccine that you're given. No, it is a scheduled vaccine. Once you start it, the only way to delay the virus to go inside and gets you infected is to finish it. If you stop in
Yeah.
any way, they might, sayang, baka hindi po
Can you just
maging
describe
effective.
it
You will
very
still get the
fast, the vaccine schedule? Kasi maraming ayaw
ah,
bumalik. Ay, naturukan na ako, ganun. Can you just describe
ah.
it very fast? So, just the vaccine schedule, okay.
There are two kinds of vaccine. The first vaccine is called immunoglobulin. The laboratory, they made the antibodies for you, go straight and then neutralize the virus right away. But
Mm.
it's very short-lived, no? The other one is the rabies vaccine, no? So one is immunoglobulin antibodies already. So it's giving you the body the chance to create the antibodies to kill or to neutralize the virus, no? But it takes time. So that's why if it's really high risk, we give the laboratory made versus how you want to make on your own. The
Yeah.
one you want to make your own, and that's when they had scheduled, no? So 0, so that's the first time that you see the doctor, give the vaccine. Then after day 3, no,
Mhm.
so 3 days after, and then 1 week after from the first vaccine, and then 2 weeks after. No, so
Mhm.
that's 0, 3, 7, and 14 from the first vaccine. No,
Okay.
so yun yung general rule. No, and then of course you might be given tetanus vaccines also.
Yes. Thank you, doctor. And also, a lot of this happens also in places where let's say I used to go to the provinces a lot. No, there are dogs that are not vaccinated for
Mm-hmm.
rabies properly. So there's
Mm-hmm.
always like, oh, a dog bite a stray dog, and people
Mm-hmm.
sometimes people also agitate them,
Mm-hmm.
animals that you see
Yes,
on
yes. Mm.
so they get bitten and then they have to get rabies shots. And then is there with the state of the country, I mean the state of how things are, have you seen just anything you can give us as to whether the cases of rabies are going down or up or they're steady, or anything else you'd like to say? Like the platform, the floor is yours.
Actually, the Philippines has one of the highest worldwide rabies prevalence, with around 200 to 300 deaths every year, as from RITM. And in actually from 2014 to 2018, I think they recorded 1,176 cases in the Philippines, no, of rabies. No? So generally, there rabies everywhere. People don't think that rabies does not exist in the Philippines. They do. We just don't see it every day, but they do. And again, what we want to emphasize is they actually kill. No, these are the things that you don't want to risk it. No, so why risk it when there's actually a vaccine to prevent you from dying, from getting the infection? So, and that's what we want to emphasize. So even in the province, I said, although 72 hours is the as much as we want to recommend, but as long as we're given, you can still be given vaccine even in a later period of time, no? But of course, we don't want to risk it, no? Pero if there's no choice, then please get your vaccines.
And as you said, if it's not available right away, basta there's another, you have, may kulit
Yeah.
your, is, at saka yung mga nasa probinsya po, kulitin ninyo yung mga health center doon.
Yeah.
Kasi
In
marami
fact,
na,
DOH,
kulitin ninyo, na alam ko, nagbigay yung DOH, ganun. Wag kayo pumayag na, wala ganun. Ayan.
DOH is trying to have a good program on rabies eradication also in the country. So for sure, even in the provinces, you'll be able to get some vaccines.
Okay. Anything else you'd like to say, Doctor? Anyone else you'd like to say hello to? Thank you for, for
no, again,
doing this.
thank you for inviting us. Nicole, it's always nice to see you again to our Makati Medical
Yes.
Center Department of Emergency Medicine, headed by Dr. Flores. No, we're always open 24/7 in Amorsolo. No, you get to have your wounds checked. And then clean it properly, give the proper vaccinations and proper medications. I'll say hello to my dad and my mom, also my family in Australia, and my brother in Cavite. But yeah, in general, and to all of my friends, yeah, nice to see you again. And in any rate, you can always
Yes,
invite
nice to
me if
see
you
you.
want to talk about anything else.
Okay, Dr. 𝗛𝗶𝗁, please come on again, come on anytime and
Right.
come back on the show soon. Thank you for
Yeah.
helping me out. And by the way, I'm just in the building. I could pop by. I don't
Right.
know, but okay, I'm here anyway.
Always
Also
a
I'd like to
pleasure.
thank from admissions yesterday here in Makati Medical Center, and Monique, the night nurse last night, was very helpful.
Right, yeah.
So thank you, Dr. Kwan. Thank you for
Thank
being on the
you.
show.
You're
Okay,
welcome.
folks, all the time we have for this week. Thank you for giving me a bit of extra time, Bernard, Kakampi Bernard Tan. We'll see you guys next week on Healthline with Makati Med. That's Dr. Mark Gawaran for you, and emergency medicine specialist here at Makati Medical Center. Like here, I'm right here too, just casting from a room. Thank you very much, everyone, for tuning into the show. Tune in again next week. Thank you, Doctor.
Thank you. Have a good day.
Okay.
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.